This clinical case study demonstrates the use of a flowable restorative as a liner in a Class II restoration and is provided courtesy of Dr. Reich of Seefeld, Germany. The products used include 3MSB Filtek Supreme Ultra Universal and Flowable Restoratives. Both use 3MSB's true nanotechnology, delivering excellent aesthetics, unsurpassed polish retention, and low wear. Filtek Supreme Ultra Flowable Restorative offers 12 shades that match the Universal Restorative, flow-on-demand behavior, yet holds its shape, excellent cavity adaptation, and lack of stickiness. It's extremely versatile and is approved for multiple indications. One of the more common uses of a flowable restorative is as a liner in Class I and II restorations. Such use is particularly beneficial in the approximal box of a Class II restoration, where adaptation is critical to minimize voids at the cavos surface margin, since these voids may collect plaque and ultimately pose a caries risk. The lower viscosity of a flowable can help overcome these challenging cases. The following case involves the removal of an amalgam filling and associated secondary caries and restoration using Filtek Supreme Ultra Universal and Flowable Restoratives. The amalgam restoration and infected tissue were removed, and a clear matrix was positioned together with a contoured wooden wedge. Following adhesive placement, the flowable restorative was carefully placed on the cervical floor at the cavos surface margin of the proximal box abutting the matrix band. This was done to maximize adaptation where the cervical floor meets the matrix band. Note that cavity adaptation is best achieved when the flowable is applied in a thin layer. Under the force of extrusion, the viscosity of the flowable will decrease significantly and flow readily along the preparation as the tip is drawn along the cavos surface margin. Maximizing adaptation at the internal line angles and the floor of the preparation was achieved using the same technique. For this restoration, shade A35 of the flowable was used to match the cervical coloring of the tooth. For the remaining restoration, the universal shade A3B was used. Since the shades of Filtek Supreme Ultra Universal and Flowable Restoratives are designed as a system, predictable color matching was assured. The proximal wall, including the marginal ridge of the restoration, was created first, using the universal restorative. Then it was light cured, using the 10 mm diameter light guide of the Elipar S10 LED curing light. Next, the composite was placed as it would be done for a small Class I restoration. After the occlusal increment was placed and the matrix band removed, the restoration was finished with a 12-fluted carbide burr. Interproximal surfaces were contoured and polished with Soflex contouring and polishing discs and Soflex finishing strips, and the occlusal surface was polished with a pasteless brush system. This photo shows the restoration at a 2-week follow-up. Note the gloss retention. Filtek Supreme Ultra Flowable Restorative is the ideal companion to Filtek Supreme Ultra Universal Restorative, delivering versatile solutions with beautiful results. For more information on restorative techniques or on Filtek Supreme Ultra Universal or Flowable Restoratives, contact 3MSB's Customer Care Center or visit www.3msb.com/Filtek.